Thank you so much for attending tonight's open studio. We are here the last Wednesday of every month at 5 p.m. Pacific and 7 p.m. Central Time. So feel free to come back another time also to see what our team members are presenting. So I will get started here with my presentation. So today we're going to talk about music therapy for older adults, both in person and telehealth. And my name is Marisa DiCamillo. I am a music therapy intern for 2 more days, and then I will be eligible to take the board certification exam and become a board certified music therapist, which is very exciting. So thank you to Harmonic Changes for supporting me. Oh, and thank you so much for wishing me well. I will continue on now with our presentation. So let's break down every part of the title here. So we had music therapy for older adults, in person and telehealth. So let's start with, what is music therapy? So according to the American Music Therapy Association, which is our professional organization, music therapy is the clinical and evidence-based use of music interventions to accomplish individualized goals within a therapeutic relationship by a credentialed professional who has completed an approved music therapy program. So that's a lot of words, but at the root of it is the clinical and evidence-based use of music accomplishing the goals of a client and the therapeutic relationship. So the therapeutic relationship between the therapist who has all this training and the client who is accomplishing their goals, with music as the connection between them. And that is how I describe music therapy to other people. Who do music therapists see? Well, now we're getting into the older adults portion of the title. Of course, music therapists see people from all parts of the lifespan, starting from prenatal to hospice care. But today's presentation, we're going to focus on older adults specifically, that particular stage of life. So in older adults, music therapists see older adults of all ability levels for wellness. They may not have a specific diagnosis, but they may be in an environment where a music therapist is and receiving music therapy services that way. Of course, older adults with a diagnosis can also receive music therapy services, and potential diagnoses that an older adult might have for receiving music therapy services include Alzheimer's disease or other types of dementia, Parkinson's disease, acquired brain injury, whether that is a traumatic brain injury or stroke, cancer, and more. Where do music therapists see older adult clients? There are many places where music therapists see older adult clients. So one of the most famous being hospice and palliative care. There are many hospices around the country and the world starting to have music therapists as an integral part of their staff. So music therapists will be part of the interdisciplinary team of a person receiving palliative care services, no matter what facility they happen to be living in or at home. Music therapists are a huge part of hospice. Music therapists can also be part of assisted living facilities where the person may not be receiving palliative care, that's just where they happen to live for their diagnosis. And music therapists can be on staff, can contract with assisted living facilities, and provide services to older adults living in this environment. Music therapists also can work in hospitals and medical centers, any place where an older adult might be receiving medical care, both inpatient and outpatient, depending on the hospital, the specific hospital, and of course the needs of the patients. Community-based care would be, an example of this might be a music therapist who is providing services in a local community amenity, a place where older adults might gather in the community. In-home services, music therapists can come to your house. Of course, that is part of hospice, but you can also have music therapists come to your house at any time in your life, no matter what your diagnosis is. And another thing that has been developed, of course, through COVID is telehealth. Though I'm sure there was telehealth before the pandemic, but through the pandemic, we have really embraced and increased our ability to provide services via telehealth. So AMTA, the American Music Therapy Association that I mentioned earlier, has a list of standards of clinical practice for each population that music therapists serve. So this is a small excerpt. It's a big long document, but a small excerpt from this document provided by AMTA goes over typical assessment areas, what a music therapist might be looking at when going into a session with an older adult for the first time or meeting a new older adult in a group. So typically a music therapist would assess motor skills, reality orientation. So that kind of means like, are they aware of where they are, what time it is, what year it is? Emotional status, spatial and body concepts, so their ability to move and also sense where they are in the environment. Long-term and short-term memory, sensory acuity and perception, so like vision, hearing, touch, and independent functioning and adaptive needs, which would be their ability to care for themselves, perform activities of daily living like dressing, brushing their teeth, feeding themselves. Those kinds of tasks would fall under independent functioning and adaptive needs. So let's talk about what music therapy for older adults looks like in person. So I have two picture examples from when I was a student. I was a student at University of Miami. So in the picture on the left, I was a music therapy student on the neurorehabilitation unit at Ryder Trauma Center in Miami, Florida. So that's where I am on the left. And then on the right, I was also a practicum student at Seasons Hospice, the Miami branch. Seasons is a nationwide hospice company. And in this particular photo, I was at an assisted living facility. And the lady on the left is my practicum supervisor. So you can see from the photos, we've got, of course, no clients are included in these pictures. It's just me. But we have lots of different instruments going on and paperwork and all kinds of things going on over here. So as an in-person facilitator with older adults, I tended to focus on 5 types of interventions. So the 5 different things that I would do were instrument play, music and movement, singing, music listening, and songwriting. So we're going to break down what all of these might look like in an in-person session for an older adult. So let's start with instrument play. So for instrument playing, you might want to use instruments to address goals including attention, whether they are able to sustain attention for a period of time, alternate attention, do 2 things at the same time, which is called divided attention. Also memory, that's actually from the picture from before. That's what I was doing with the xylophone. I was giving the client short memory sequences and having her copy, so short-term memory. And also, of course, gross and fine motor skills, because playing an instrument requires that you are interacting with it in some way with your body. So, but playing instruments, you can do it in many ways besides holding it with your hand. There are techniques that you can use to practice movements in other ways with playing instruments. And in neurologic music therapy, which was a huge part of my personal education as a music therapist, this technique would be called therapeutic instrumental music playing. So, for example, with a drum, you can play a drum with basically any body part, not just your hands. You can play a drum with your knees, with your feet, with your elbows, with your shoulders, and playing instruments in this way that's not necessarily the accepted way is practicing a particular movement and getting it in the rhythm and stretching out range of motion, the velocity of a movement, so like how quickly they can move. All of these things can be achieved using instruments in an in-person session. All right, music and movement. This is similar to the instrument. Oh, I see we have something in the chat. Oh, yes, it is very fun. So music and movement, we can address similar goals to instrument playing. Commonly, we would also be addressing gross and fine motor skills, whether that's through a sort of music-led warm-up. That's a common way to start a group, getting them ready to do other activities in the group and getting their movement warmed up, whether it's their arms, their head, their fingers, all of that. And also attention with music and movement can be addressed, having to copy specific movements at certain times. I would say that memory would also be a part of music and movement, having to remember certain movements at certain times. Like, for example, the song YMCA, knowing when to do the YMCA in the song. Singing. Singing is such a wonderful intervention, and you can do so many different things with singing. But commonly, singing, of course, addresses vocalization, keeping the vocal apparatus healthy and operational. Some diagnoses, such as Parkinson's or stroke TBI, lead to vocal motor or vocal and oral motor problems, where it's difficult to make sound, or having with Parkinson's specifically, often the rhythm of speech is disrupted. So singing can be very helpful for that. So vocalization and oral motor skills. And singing, of course, can also be helpful for memory, with knowing the lyrics of a song and going back to, at the beginning, I was playing some songs that might be used in a session with older adults. So bringing back those songs from their early adulthood years and having them sing them and then reminisce about them after can lead not just to short-term memory, but long-term memory, exercising it. Since we're talking about in person, I also want to emphasize that group singing, as you can see in this photograph, the act of group singing is incredibly powerful in bonding people to each other. So participating in a group singing experience gives socialization and emotional expression benefits that are very difficult to replicate in any other way. And I know that many older adults have said that that's one of their favorite things about it. Music listening. So with music listening, you can address attention, of course, keeping on the same theme of sustaining attention to a piece of music over time and seeing does their attention sustain for the length of the entire song. Emotional expression and regulation, having them be able to choose a song and express themselves emotionally in that way. And also, if the song is particularly meaningful to them, having the ability to regulate their emotions in the moment. And memory and reminiscence, as I was discussing earlier with the singing. It's similar with music listening, having them listen to a song from their childhood, early adult years, and then talk about where that song brought them afterwards. And the last thing is songwriting. This, I feel, is not quite as common, but it is very fun to do, especially with older adults. So common goals you can address with songwriting for all populations, but for older adults, since that's what we're talking about right now, include executive functioning, which is how your brain kind of makes sense and plans and structures the world, having a way to organize your surroundings and, say, be able to complete complex tasks like throwing a dinner party or going grocery shopping or going to multiple locations in the same car trip. So songwriting can help with executive functioning. And of course, songwriting can also be an avenue for emotional expression through how they are putting their words into music. So that's a sum of some things that I have done with in-person music therapy services for older adults. So now we're going to take this opportunity to talk about telehealth music therapy services. So thanks to Harmonic Changes, I have done my entire internship, all 6 months of it, all 1,000 something hours, right here from this very spot. And I have participated in many different kinds of sessions with older adults, both not in person, but both individual and group settings. And so the photo I've got here, this is from one of our Music Men's Minds groups, which is a music group for older adults who have a diagnosis of Parkinson's, Alzheimer's, any sort of neurodegenerative disorder, and their caregivers. Of course, since the pandemic has brought Music Men's Minds online, their reach has gotten so great that we have people who have different diagnoses coming to this group and finding support in the community that has been created with Music Men's Minds. So with telehealth, we've got these same 5 interventions that we have done on the screen. So they're the same interventions, but the way they are facilitated because of the platform is slightly different. And there are some considerations that you have to bear in mind when you are planning these interventions for a telehealth setting. So to sum up, you can do basically anything that you would do in person via telehealth. You just have to know the technology and its limitations and be able to work around it and get creative to achieve the same results. So let's get back into all of the different kinds of interventions. So instrument play again. Again, we're still addressing the same goals of attention, memory, and gross and fine motor skills. But some important considerations that you might have to think of are that they might not have access to all the instruments that I, as a music therapist, might have. So in the in-person setting, I would provide instruments to my clients. But with telehealth, I can't put my instruments through the screen at them. I have my own instruments. I have my egg shaker and my tambourine and my guitar over here, but I can't give them their own egg shaker or tambourine or guitar. So with instrument playing, you are kind of limited to whatever instruments that they happen to have on hand. However, you don't have to be limited to instruments that you buy from a store. A lot of our older adults have been very creative in making their own instruments out of things that they've found at home. So, for example, we have people using kitchen tongs as castanets, putting dried beans or lentils in their pill bottles and making them into shakers. All kinds of different instrumental possibilities are found when you get creative and allow yourself to find the musical potential in everyday objects. So that's something that we have really encouraged during the pandemic, with getting people to have their own instruments at home and making their own instruments for their own use. Music and movement. Again, we are still addressing gross and fine motor skills and attention with music and movement activities. But there are a couple of considerations that you need to remember when doing music and movement via telehealth. So one of the things is that on telehealth, usually you're inside of this little box. So if you want to work on leg movement, they can't see your legs. So you have to kind of either be able to walk them through what they're about to do, or angle the camera so that they can see what you are doing. So for the knee drumming example I gave earlier, I'll do it with my tambourine. I'd have to back up all the way over here so I could see. I would want them to lift their knee and hit their tambourine. Another consideration with music and movement is, especially in a group with Zoom and the natural delay and lag that comes with the platforms where we do telehealth services, people it may not seem like they're moving to the beat from your perspective, but they are moving to the beat from their own perspective, because it takes time for the musical signal to reach their house from where you are. So they may look like they're out of time with you, but as long as they're relatively even and matching what you're doing in that way, they probably are hitting the beat just fine and feeling that and then training with the rhythm. So trusting that process, that takes a little bit of, yeah, they got it. You have to let that go a little bit and trust that they are following what you're doing, even if you can't totally see it. With singing, of course, can still be done no matter where you are, because we can sing everywhere. But one of the important considerations for singing in a telehealth environment is often in a group where more than 2 people are, you will not be able to hear anyone and they will not be in time. Because the way that the software works, it doesn't allow for multiple voices to be happening at the same time, and also it doesn't play them in time. So the ways to get around this are numerous to achieve that group singing experience that has been so beneficial to so many people. So typically when we're leading a telehealth session, what we'll do is have the therapist be unmuted, and then everyone else is muted and singing in their own home. So they can see everyone else singing. They can't necessarily hear them. And that's in a session that is a yes. Oh, how big are the sessions? It depends. So for example, Music Men's Minds, which I've been referring to quite a bit, that group can have anywhere from 25 to 40 people on the platform at any given time. So that's a big group. Whereas we can also have individual sessions where it's just me and one other person on the other end. And with that, it's a little easier to coordinate the singing, because when there's only 2 people, then the platform can handle it easier. And it's a little out of time, but I know that going into it, and they hear themselves singing along with me. So that's the most important thing. So another way that you can, with a large group like Music Men's Minds, for example, another way that you can collaborate with singing is have everyone record their own parts and then send them in to some person who will compile them into one big recording. And they have done that for their performances. That's not an everyday thing because that process takes a long time. But for performances or other special events, you can do that to give the semblance of a virtual choir. I'm sure if you have been on social media in the last year, you have seen many virtual musical ensemble videos, and you can do the same with older adults, of course. Music listening. So with this, we're still working on attention, emotional expression, memory, and with music listening, there are, with the technology, this is actually kind of a benefit with telehealth. So in an in-person session, I typically would perform any songs that a client wanted to listen to live with my guitar and my voice. But if there is a need for a very specific recording, with telehealth, we have Google right here and Spotify and all of these music sharing platforms. So with a group that involves a song sharing activity where people say, I want to hear this song by this artist, you can easily go into whatever music sharing service that you have and share the sound to everyone through the telehealth platform so they can all hear it the same as they would if they were playing it themselves. So that is an added bonus of telehealth with music listening. And of course, with performing it live, it would be a similar experience to an in-person, just making sure that everyone's muted while the music listening experience is going on in case there's anything going on in the background. And that's a good rule of thumb for telehealth in general, is having people be muted if it's a group setting. And last but not least, songwriting. Oh, do I usually know how to play the songs they request, or do I learn on the spot? It depends on the song. Sometimes if I know it, I will absolutely play it. And if I don't, sometimes I will work my way through it. And other times I'll say, you know what, I'm gonna let Frank Sinatra cover that. Or I will say, we'll do it next time. So it depends on the clients and their needs in the moment, really, of what I will provide for them if I don't know the song that they're asking for. But usually I can get my way through it. And with songwriting on telehealth, that's another kind of added bonus of the technology. So with an in-person session, you might be writing out, if they're writing out a song, you might be doing it with pencil and paper and having them fill in physical blanks on a piece of paper that you have pre-prepared. But with telehealth, you can share your screen with Microsoft Word, for example, and have the lyrics in there. And then they can tell you what they want to say, and then you can easily just type to fill in the blanks. And you can make changes very quickly with the typing, as opposed to with handwriting, you'd have to like scribble or erase and do all of that kind of thing. So that is another added bonus of telehealth, is having the technology of word processing software at your fingers in the middle of a session, and to be able to share it so they can see it and them to be able to tell you, that's what I want. No, that's not what I want. And they have the freedom to be able to change their mind about what they're saying and doing, which is very nice, especially for writing a song. So these are some general considerations for telehealth. And with for telehealth, caregivers play a much larger role in a session than they might in an in-person session, because the music therapist is not physically there in case something happens with a client needing water, or they need assistance getting up, or anything like that. And also, the caregiver has to help the client adjust to using the technology. Sometimes they get really confused with the technology, and sometimes they don't quite understand that you're not physically there, you're on a screen. So having the caregiver be able to set up the iPad or the phone or the computer and have them just seated and ready to go for the music therapist to do the session, that's an important role for a caregiver in a music therapy session. And of course, with physical movement and instruments, the caregiver will have to help with that if the client doesn't have access to the instruments, and if they need assistance with physical movement. And of course, technical considerations that come with telehealth. So an important thing to note is internet access. So clients, if they're in a rural, and the cool thing about telehealth is that it has allowed for music therapy to reach so many corners of the world that it might not have reached before. But also, internet access, not everyone has it. Like rural communities, they might not have the best internet for supporting video conferencing. So having access to internet that is strong and has a consistent connection for the length of time of the session can really affect how the session goes. So like if there's dropping out or some kind of internet related issue, that can affect a client's access to services. However, with the telehealth session, you can use a variety of devices. You can use a phone, a tablet, or a computer. Usually people prefer to have as large a screen as possible so they can see the therapist better. But if all they have is a phone, at least they still have access to the session. And with a phone, you can use data. You might not even need to use internet if it's being a little dicey. And for the last thing, clients might need assistance using technology if they are unfamiliar. So as I said on the last slide, that's another point where the caregiver might have to step in and say, don't touch that button, that makes it go away, or having them stay where they are and not like get up and go somewhere else because they don't perceive that like the therapist can't see where they're going because they're just on the little screen. So that's where the caregiver's role in the session, as I said before, is really, really important because they are giving clients access. The caregiver and the technology are what give the client access to the services in a telehealth music therapy session. So those are two of the most important things that you have to have ready to go before you can have a successful telehealth session. So in conclusion, music therapy services can be beneficial to older adults no matter the modality. They can help older adults reach whatever their particular goals are, and they can give older adults who are isolated the ability to connect with people. Especially in the pandemic, there were so many older adults who were isolated because of COVID. But now that the pandemic is easing up, there are still older adults who are at home all the time. They might not have the accessibility of leaving their house without assistance. And with telehealth, we can come to them if they are in a place where they don't have a music therapist nearby. We can come to them no matter how far away they are. I am seeing clients 2,000 miles away in Chicago from my room here in California. So telehealth music therapy can go anywhere. And that is one of the best benefits of it, I think. Even with all of the creative solutions that come with telehealth, it can go places where in-person sessions might not be able to go. And that is one of the wonderful things about it. So thank you so much for attending this session tonight. This is our social media. If you are not already following us on Instagram, Facebook, and or Twitter, those are the handles and everything. And I think if you scan this QR code, it goes to our website. Not totally sure. And if you would like to get in touch with Harmonic Changes about potentially getting services for an older adult, both in person and telehealth, as Harmonic Changes offers both, you can email info@harmonicchanges, call the phone number, visit the website, all of those things. So thank you so much for coming tonight, and I hope you have a great night. And we'll see you next month for, I don't even know who the next person is who's doing the next open studio, but whatever it is, I'm sure it will be fabulous. Alrighty, good night. I'm going to put our music back on as a way to close out our session.